Greetings and welcome to our first 2008 program, The View from the Summit. This is Gene Tyre wishing you a belated happy 2008. We know that 2008 is going to be a great year for you. And I can think of no finer way to begin a new year on The View from the Summit than with my very, very special guest today. We are so pleased to have Dr. Michael Cushing of Georgia Bone and Joint and Russ Foley of Georgia Rehabilitation Center as our special guest today. These individuals are tops in their fields. They do a tremendous job here at the Summit Healthplex, and we're going to spend some time today giving you the opportunity to come to know them personally, and then they're going to be sharing with you some very, very important information concerning orthopedic surgery as it relates and physical therapy as it relates to shoulders. Again, Dr. Cushing, thank you for taking time out of your busy schedule. You're a busy man. You've been over at the surgery center all morning performing shoulder surgery, and it's great for you to be with me on The View from the Summit.
Thanks for having me.
And Russ, it's always great. You're with us quite frequently, and you've become a pro on The View from the Summit. But your gifts are so many, and you do a great job as a physical therapist. And welcome once again to The View from the Summit.
Thank you, Gene. My pleasure.
I've been so impressed with the relationship between Dr. Cushing and Russ Foley as they provide the finest of care for the patients that come to each of them. They work together. And I wanted you, as our viewing audience, to have the opportunity today to just spend some time with Dr. Cushing and with Russ Foley. And Dr. Cushing, if you would take just a few moments and share with us how you became interested in the practice of orthopedics and a little of your educational journey.
All right. Orthopedics became an interest of mine through my athletic career as a high school athlete and having injuries and seeing orthopedic surgeons.
What sports did you participate in high school?
Well, my initial injury was actually training for a triathlon when I was a freshman, and then swimming was my main sport, and so I had some shoulder problems then, and in talking with the doctors and going through the rehab, became interested in orthopedics and then pursued that career. I did my undergraduate training at Indiana University.
Were you in athletics at Indiana?
I did. I swam at Indiana.
So you were on the swim team at Indiana University?
I was.
Great.
I was. And then went to Medical College of Georgia for medical school. Pursued my orthopedic residency at Georgia Baptist, or Atlanta Medical Center now, and then did a fellowship in shoulder surgery at the Houston Clinic in Columbus.
And how long have you been with Georgia Bone and Joint?
5 going on 6 years now.
Well, you have endeared yourself not only to the persons here at the Summit Healthplex, but to our community, you and your entire family, and we are so very fortunate to have you a part of our team here at the Summit Healthplex. And Russ, you've been a part of this community for a long time, and as a dear friend of both of ours once said, Russ Foley is the consummate professional. Share with us a little bit about your journey. How did you become interested in physical therapy?
Well, it's interesting that a lot of our backgrounds parallel because I was interested in sports as well, both in high school and college. And unfortunately had a career-ending injury when I blew out my ACL at that time. And in those years, that's a long time ago, and got exposed to physical therapy as well. And one thing led to another, and changed my major, went into physical therapy, and finally graduated from Northwestern University in Chicago with my therapy degree, and have been here about 19 years.
Well, I know that Russ Foley and Michael Cushing spend a lot of time with each other. You're talking about patients, and from time to time I know you'll call Russ Foley up to your office, and then I see you guys in conversation down here at Georgia Rehabilitation Center concerning your patient. How important is it? And I think this is such a vital part of the Summit Healthplex. It's something very unique that we have to offer here, that we have Georgia Bone and Joint and Georgia Rehabilitation Center at the same location. How important is it to have a strong relationship and a cooperative spirit with the physician and the therapist? Dr. Cushing, I'd like for you to respond, and Russ to respond to that question.
I mean, I think it's an absolute imperative, and probably makes the Healthplex a step above everybody else. I think communication between the therapist and the physician is of the utmost importance, both before surgery and just in general rehab, and also after surgery with the rehab afterwards. Whether it's problems that arise and there's easy communication between them, I think it gives the patients a comfort level as a therapist will be up in the office talking with the patient, the doctor. All three are involved in communicating. Communication, I think, is the key and what is so important about the relationship we have here.
Russ?
I mean, he summarized that very well. One of the things that we have the luxury of, the patient may come into the office and see Dr. Cushing, one of the physicians, and the way they present that day, they go through the medical screening, they get referred to rehab. It may be a couple days, and we will see them, and their condition may have even changed by the time they get in to see us in therapy. And that gives us the opportunity, if we need to immediately go back to the physician and identify what we're seeing that is either the same or different than what they saw. And it really allows the checks and balances of the system to work best for the patient. It really keeps the patient in the center focus to progress them as quickly as we can.
I know, Dr. Cushing, that you and Russ work together, and the patients that come to see you are so pleased. You're a shoulder specialist. You spend a lot of time taking care of the shoulders of people in this community, and I've heard so many outstanding comments about your professionalism. Each comment that I hear speaks of the way you relate to the patients in such a warm and positive way, and they feel that they're with someone who really cares for them and wants to provide quality health care for them. And I want our viewing audience to get to know you and Russ Foley from a little bit of a personal dimension today. Share with us some of your interest away from the Summit Healthplex. I know that family is so very, very important to you. Share with us some of your interest. How you like to spend your time when you're not in the surgery suite here or up in the clinic at Georgia Bone and Joint?
Well, again, I think, yeah, I mean, my priority outside of work is my family and spending time with my kids, which I have 4 of them, and with my wife, which is where the priority is. I also enjoy exercising. Have trained for a triathlon and gotten more involved in that as far as biking and running and swimming, and I enjoy those activities.
Have you done a
as well.
triathlon before?
I had just done one recently in this past year, and I've kind of gotten me back into exercising and training for those type of activities.
Well, your reputation as a shoulder surgeon is sterling. You do a great job because we know that you care what happens in the lives of the patient. And Russ, your reputation is sterling, not only in this community, but all across this nation. You're just the finest. And share with us, if you will, some of your interest. I know that you are a busy, busy man, and your work takes up a lot of your time. But when you have those spare moments, what do you enjoy doing?
Well, the family and my lovely wife as well. And outside of that, unfortunately, I do a lot of not necessarily recreational reading. It's a lot of the literature reading, keeping up with the newest researches in the field and patient care. But all the outdoor activities. I've always liked sports and the sports medicine approach, and so it has a lot to do with water. We'd like to be there as well, so boating is a lot of fun.
I want our viewing audience to know that I am so privileged today to be here with Dr. Michael Cushing of Georgia Bone and Joint and Russ Foley of Georgia Rehabilitation Center. Dr. Cushing is one of the outstanding shoulder specialists in this part of our land. He is so gifted, and persons from throughout this region come to him. He is a part of a growing practice because he communicates that what happens to you really makes a difference to me. And then Russ Foley is the example of excellence in the field of physical therapy. He gives the best of his professional abilities to his patients, and he makes a difference in the lives of his patients. So when you have a team such as Michael Cushing and Russ Foley working together, it puts them above, way, way above a lot of other entities that attempt to provide the same type of care. They're the best as they work together. And so I want you to meet them today. They're going to spend some time now sharing with you some ideas concerning shoulder replacement, let you in on some of the things that they do, and then a little later on you're going to be able to meet a patient of theirs. But right now, let's take time for a word from our sponsor.
We are back with Dr. Cushing, and what we'd like to do is spend the remainder of the program really getting more into the clinical components of what we do on a daily basis. And we want to focus on the total joint replacements, and in this case, the total shoulder replacements. So we'll talk about some of the indications, we'll show some models, and then the real fun part of this will be bringing in a patient that we can do some demonstrations on evaluations and treatment. So what I like to do is turn the program over to Dr. Cushing and see what we can learn about total joint replacements for the shoulders.
Okay. Arthritis is a problem that we see in the office every day. The hip and the knee are obviously more involved than the shoulder, but the shoulder is about the third most common. I see a lot more shoulder arthritis being my specialty. Typically, patients come to the office with shoulder pain, and more often than not, it can be more rotator cuff related, but then there is a set of patients, a subset, that it is more related to the arthritis in their shoulder. Typically, there will be loss of motion. There's pain with any kind of movement of the shoulder. X-rays help in further delineating that, as well as the physical examination. Patients who do have arthritis in the shoulder that fail conservative treatment, whether that is injections, there may be some physical therapy things we can do to prepare the shoulder for a replacement, but outside of that, when you get bad enough arthritis with the bone on bone, the therapy is not as effective. You can try anti-inflammatories. When those things don't work, patient is having pain every day, it's interfering with their activities of daily living, then a shoulder replacement is recommended. We have a model of a shoulder replacement. Basically, when we replace the shoulder, there's two components to it. There's a component that goes on the humerus, or the ball of the ball and socket joint, and there's a stem that goes down the center of the bone, and then a metal ball that articulates with a plastic glenoid piece that's cemented into place. That articulation has a smooth articulation. Anyone who's had a joint replacement, the pain relief is very good from these, and probably the number one indication for having a joint replacement is pain relief. Function is secondary, but usually most patients have a good rotator cuff. Their function can turn out very well with that. A big part of it, as I tell most of my patients, is the surgery is about 50% of it, and then the other 50% involves the therapy.
Okay. Typically, when the patients come and see you, what have they been complaining about for the last several weeks or several years that really gives you the idea of what this is leading up to as far as it relates to the degenerative joints?
A lot of the pain is more centered in the front of the shoulder. They again have loss of motion. They have a lot of crepitation or the grinding, basically, of the bone rubbing on the bone, and so they can feel that as well.
Okay. The nice thing about what Dr. Cushing does is when he does his surgery, he actually relieves the part of the bone that actually is causing all the pain. And then unfortunately, we see the patient and we're the ones dealing with the post-operative pain and actually putting them through a lot of activities that cause pain. But the good news is, the reason they came in to see Dr. Cushing, that actually has been removed and taken care of. And then once they get passed through the rehab part of all this, they really do have a much better quality of life. What type of limitations do you see on strength before they have their surgical replacement?
I think most patients will have a lot of weakness in their rotator cuff because the pain they were having, they're not using the shoulder as much, so the muscles aren't functioning as well. So I think there is a lot of preoperative weakness that they get just due to lack of use.
Okay. And from rehab with this as well, this is an older population, and so a lot of the things that we're dealing with on the joint restrictions, the limitation of motion, that's been taken care of by the joint replacement, but we now follow protocols that really stage them through the recovery process to make sure that there's adequate healing of all the tissues before we start stressing those. So early on, we do some pain management approaches as well. We try to maintain some initial range of motion, and then as they progress, we recapture as much of the full range of motion as we can and the full strength to return to the normal ADLs. Now, Dr. Cushing, you're talking about what is considered the typical or traditional total joint replacement. What's the newest stuff regarding the reverse total? What's that all about?
There is technology out now. It's been going on in Europe for years, where they've been performing what's called the reverse total shoulder replacement. It's indicated in patients who do not have a rotator cuff. Their rotator cuff's been torn for quite some time. So what they find is they have very little elevation of the shoulder. They cannot raise the arm up, and a lot of times it develops into pain. We do have a model of that as well.
So at this point, the rotator cuff
Is absent.
surgery is really not an option. At this point, they can't have a procedure to help the rotator cuff.
Absolutely.
Okay.
Over time, after the rotator cuff's torn, if it's not addressed at that time, it retracts and gets to a point where it's not repairable. The humeral head over time then will raise up and essentially shorten the deltoid, which they don't have function in their arm because of that. So the reverse total shoulder, like I said, which has been around in Europe, it's been in America now for the last 7 or 8 years. They've revisited the idea, restores some function. It's not as good as the regular shoulder replacement as far as function. Pain relief is like any joint replacement, does very well. The idea behind it is it lengthens the arm a little bit and puts a tension on the deltoid to make it more functional.
What is the difference as far as the end result and range of motion between the two?
Most of the reverse patients will range anywhere from 90 degrees of forward elevation up to 140. Rotation side to side is variable based on if any of their remaining rotator cuff is functional.
Any major differences on postoperative recovery between the two?
It's probably a little easier to recover from the reverse total shoulder replacement. You don't have the rotator cuff in there. You don't have the tissue planes and scar tissue that'll form as much, so the rehab can be a little bit easier.
And then of all the patients that have total shoulders, how many are really candidates for the reverse total?
Well, they're different indications. People who have a regular total shoulder replacement are going to have an intact rotator cuff. Possibly over time they could tear the rotator cuff, but ideally that would be caught and they wouldn't develop into a situation where they'd need to have the reverse performed.
Now, the patient that we'll be seeing in just a minute, what type of procedure did he have?
He had the regular total shoulder replacement. He had osteoarthritis of the shoulder, was limited in his motion, his function, and was having a good bit of pain through his daily activities.
And we have some x-rays that we'll be showing as well, so it really shows the change in the joint surface, and then we also have some x-rays that will show the postoperative films that show the total shoulder replacement, what it looks like on the x-ray. And you'll be talking a little bit about that today.
Yes.
So why don't we go ahead and meet the patient and see what the clinical indications are.
Joining us now is our patient, Mr. Freddie Bertishaw. Is a gentleman who I saw in the office with osteoarthritis of his right shoulder. We went through the different indications. He had a lot of the clinical symptoms as far as the pain, the interfering with his daily activities, and 7 weeks ago underwent total shoulder replacement. Of note, on his contralateral side, on the left side, arthritis does not always affect both sides, although it can. If we look at his good side, his motion as far as raising over his head, he's able to raise it all the way over his head. With his arm at his side and looking at his rotation, again, the arm rotates fairly well. He has a little bit of popping in there, and that could be some early arthritis, but he's not at a point now with either the pain or function that would consider shoulder replacement surgery.
How's that side look today with his range of motion?
Today, looking at him, compared to where he was before, where before the surgery he probably had maybe 5 degrees of rotation this way, a lot of crunching and popping in the shoulder joint. It's very smooth now. He's coming out even further than he was before the surgery, and we're very early on in the process. To do the surgery, there's a rotator cuff muscle in front that we have to cut through, and that has to be protected in the first 6 weeks. So we haven't done a lot of, as you'll be able to explain, a lot of the rotation that way. So it's already moving better this way. He's probably not warmed up enough, but even coming forward, we can raise him forward without too much discomfort. There is going to be some discomfort from the soft tissues from the surgery, but not as much from the arthritis.
In the first 2 weeks, what's the most important focus that you have for his motion safety precaution, things he should do, not do? Is he in a sling?
He's in a sling for 6 weeks after the surgery. The most important thing in those first 6 weeks is the motion. Strengthening something that will come with time. We worry mainly about, as you were saying, decreasing the pain and improving the motion. I think as the joint moves more and you're able to mobilize it more, the pain definitely decreases.
How's the pain now compared to 4 weeks ago?
Oh, doing much better. Been off the pills a long time, and you know, all the activity in here with Derek and you is moving things right along, I think.
It's not too bad.
Not
No.
too bad.
All right, what we want to do is also have Mr. Freddie, he'll lie down and we'll do some of the motion techniques on his shoulder and give you an idea where he is since he's about 8 weeks out. At this point, there's really nothing holding us back, no precautions, and so we're able now to push him a little bit harder and recapture some of that motion. And the most important thing with him is his home program. So he's been very compliant and working through that, and he's doing real well. So we'll come back and have him on the table and go through some motions. All right, we have Mr. Freddie on the treatment table. But what I did want to show to begin with is what is really going on mechanically with the shoulder, and we have a skeleton model here, and this is the normal anatomy without the total shoulder, but the concepts are identical. What we're trying to do is during the first phase of healing, this is fairly immobilized in the sling, and so it really is going through all the healing factors. But one of the things we have to do is restore the joint play and the movement that goes within the joint, because as we move the arm, there's a tremendous amount of motion that is happening at the shoulder joint. So protecting it in the early phases of healing is important, and now we're in the phase of restoring his motion as it comes back. And it really does have this joint play, which allows us to really work with all the capsule, the muscles, the ligaments that stabilize the shoulder, and then work on strength, which is the rotator cuff as well. So that's really what we're looking at from the anatomy. And with my left hand, I'm actually feeling the joint and feeling the type of movement pattern that it's presenting with today. And to give you an idea how much flexion he really has the ability, which is very nice at 8 weeks, to look at this amount of range of motion that is passive range of motion of shoulder flexion. He also has abduction, taking the arm away from the body, which is also coming up very nicely. And for him to be able to have this kind of mobility, that means that this anatomy is really now restored to his functional movements, which is a great thing of what the total joint replacements do. He also has external rotation that you saw Dr. Cushing move as well. And the important thing here from early on, if there's a rotator cuff to get into do the joint, if there's a muscle that actually contracts and pulls his hand to his stomach, we don't want to use that muscle early on because that's a muscle that's been repaired with the total shoulder replacement. On the other hand, we don't want to stretch that surgical repair by going in the opposite direction. So we really have ways of protecting this to let it heal appropriately, which allows it to tighten up a little bit. And now we're at that phase of actually working with increased flexibility. One of the things that we will do is also restore the natural joint play by positioning my hand right on top of the shoulder joint and that new total shoulder replacement, the head of the humerus, and we restore the different motions of that joint with the joint play to now allow this end range motion to continue to improve. So here's what we have from the passive range. Then we'll start recruiting the muscle activity. Go ahead and make a fist. Hold your arm right here. So he's got strength that he can hold it against gravity, but we will start to now challenge the muscle strength and develop proprioception in the joint to have the muscles start to respond, and he's actually doing very well with this. Now I'm going to have him sit up and stand up for me on this side of the table. I'll move our skeleton. And the last thing we want to look at is go ahead and have a seat. And this is actually an exercise that we started yesterday to look at strength. What I want you to do is lift your arm straight up over your head. Good. Okay, so that shows, and now let it relax, that he has range of motion from when he was on the table up here, but he doesn't have the strength to use that. So we're going to try to build strength now in the last part of that motion. So go ahead and face the table, lean forward, and show us one of the hardest exercises you did yesterday. Go ahead and lift for about 3 inches. And now we're starting to get the strength in that rotator cuff and bring it into usable parts of the range of motion. So, Mr. Freddie, I want to thank you for being here with us today. Dr. Cushing, it's a pleasure working with him and you. You've been a great patient, and the number one thing is a home program, and you've done extremely well.
Well, it's been a real pleasure being here, and I've really enjoyed this program and coming here and doing the exercises with Derek and you.
Well, he's going to keep coming in with us. We're going to get him back to his normal activities. So, thank you, and we'll see Dr. Gene Tyre.
I'm sure you found our program today with Dr. Michael Cushing, Russ Foley, and Mr. Fred Burdishaw to be very interesting and very, very informative. Dr. Cushing had some other responsibilities, and so he had to slip out as Russ was sharing therapy with Mr. Burdishaw. But I want to thank all of you for taking time out of your busy schedule to view the program, The View from the Summit. We're here to help you. We're here to help you improve your quality of life. And we want you to remember always that you control your healthcare destiny.